Okay, today I'm going to be talking about the sentinel lymph node biopsy procedure, specifically in regards to breast cancer surgery. So, if you have a breast, here's the arm out here, here's your armpit area, and up here, we only really do a sentinel lymph node biopsy for invasive breast cancer. So, that means that you have a mass in the breast that is considered invasive breast cancer, usually biopsy proven by this point with a needle biopsy or some sort of surgery that has proven that there's cancer in the breast. And what happens is that there are channels that flow throughout the breast called lymphatic channels, and these channels connect to lymph nodes in your armpit. And there's about 15 or 20 lymph nodes in your armpit at least. And the sentinel lymph node is the lymph node that is connected to the area of the cancer and is the first draining lymph node of the breast and certainly of the area of the breast cancer. So if cancer cells break off and travel through the lymphatic channels, they tend to get stuck in the lymph nodes. And the sentinel lymph node is the lymph node that is most likely to contain cancer cells if it has traveled to the lymph nodes at all. Lymph nodes are a normal part of your immune system. You have thousands of lymph nodes in your body. Your body does not miss removing a few lymph nodes from an immunologic standpoint. So if you have an invasive breast cancer and you want to check to find the sentinel lymph node, we use typically two types of dye for this. One dye is injected into the breast and is radioactive. The radioactive dye travels to the lymph node and gets stuck in the lymph node and emits radioactive energy. And during the surgery, we actually use a handheld Geiger counter radioactive probe monitor, and this will tell us when we have radioactive material in a lymph node. We also use blue dye, which is injected into the breast around the tumor or around the skin of the nipple. And this blue dye also travels through the same lymphatic channels and stains the lymph node visibly blue. So you have two types of dye that should stain the same lymph node area. Now, the sentinel lymph node is usually done from a separate incision in the armpit if you're doing a lumpectomy surgery. If it's during a mastectomy surgery, you may be able to remove the lymph node during the mastectomy incision or through the same incision as the mastectomy. Once the sentinel lymph node has been removed, there may be several lymph nodes. This can do one of two things at this point. One is called a frozen section, and frozen means a pathologist looks at it immediately. The good thing is you can get an immediate result. The pathologist will tell you during the surgery if your sentinel lymph node contains cancer cells or not, but this is less accurate. The other way to sample the sentinel lymph node, which we will call SLN, sentinel lymph node, is to send it for a permanent section. Permanent means the pathologist takes their time, they embed it in wax, and they do special stains, and this is about a week to get the result. It's not immediate, but it's much more accurate. Now, when we use frozen section for sentinel lymph nodes, typically this is during mastectomy surgery. And the reason we do a frozen section during a mastectomy surgery is that you would want to know while you were working through a big incision if the lymph node had cancer in it, and you may do a complete axillary dissection if you did find cancer in the lymph node. This is because you're there, you already have a big incision, and you're probably not going to get radiation to your chest and lymph nodes. So axillary dissection, which is talked about in a separate talk, means we remove all 15 or 20 lymph nodes from your armpit. Now the permanent section is really becoming the more common thing that's done with lymph nodes during sentinel lymph node surgery. And the reason why is there was a big study called the ACOSOG Z11. It's not important to know what that means, but this study looked at thousands of women with sentinel lymph nodes for breast cancer and said that if there's a little bit of cancer in the sentinel lymph node, that the other lymph nodes may have a little bit of cancer in them. Maybe about 1 in 5 women will have cancer in the other lymph nodes. But if you just remove the sentinel lymph nodes and you give radiation through the breast, which is very common, almost all lumpectomy surgery for breast cancer gets radiation through the breast, that this radiation will kill any small cancer cells left in the remaining lymph nodes. So you do not typically need to do a complete axillary dissection if you have a small amount of cancer in your sentinel lymph node. But this is based on the fact that you would get radiation. So in general, it's better to do just the sentinel lymph node. It has a very low risk of causing arm swelling, what we call lymphedema. It has a low risk of causing nerve injury or causing problems moving the arm or frozen shoulder. So it's generally a safer procedure. Now, questions you should ask your surgeon is what kind of dye would they use for their sentinel lymph node surgery? Are they going to use a radioactive dye and a blue dye, or one or the other? You'd also want to know if they are going to do a frozen section on the sentinel lymph node, and if they are going to do a frozen section, are they planning on removing the rest of the lymph nodes with an axillary dissection during that surgery or not? And then you don't need to push prior to the surgery, but if they do get a permanent result on the lymph node that says there's a small amount of cancer, it should be worth a discussion that you may or may not need to have all of the lymph nodes from your armpit removed if you are going to have radiation to the breast. That's the end of sentinel lymph node biopsy introduction. I hope that was helpful.